Hello everyone, I'm Dr. Manish Shetty, consultant physician at Raheja Hospital. Well, it's a happy time, monsoon is here. India has won the T20 World Cup and we are all rejoicing. Free from the scorching heat summers that we faced for the last 3 months. What I'm going to talk today is, monsoon along with its joy also brings a lot of diseases which are specific to this season. Let's classify them as cold and flu, which is the most common thing right now which we are facing. We have normal viral infections presenting as fever, cough and sore throat, and also to keep in mind the H1N1 infection or the swine flu, at present quite rampant, presenting with the same symptoms. Timely treatment will help us. After the cold and flu, we talk about the waterborne infections. Well, during monsoon there is a lot of contamination which occurs, stagnation of water which occurs, which leads to these kind of diseases. Most commonly is typhoid. You have hepatitis, which is also due to this contaminated water. Next, we talk about vector-borne diseases like dengue, malaria, and chikungunya. These are transmitted by the bite of the mosquito, presenting as high-grade fever, chills, weakness. A timely diagnosis and treatment will help you overcome this disease. Also, along this, we have one more vector-borne disease, which is leptospirosis, transmitted by the rat urine when we walk in flooded waters. Symptoms of high-grade fever, body ache, jaundice have to be kept in mind when we have a history of people walking in stagnated waters. We also have stomach kind of upsets which happen. We have nausea, vomiting and loose motions as a common presentation of diseases during monsoon, mostly due to bacteria or due to viruses like rotavirus, which is quite common in children. Lastly, we also talk about how do we prevent these diseases. Well, first and foremost, it's very important to maintain proper hygiene, wash your hands properly, see that the food that you take is quite clean and the water that you drink is boiled or filtered well. Keep your surroundings clean so as to allow stagnation of water and accumulation and breeding of mosquitoes, which will lead to these vector-borne diseases. Lastly, you have to treat yourself according to your symptoms and take timely help. Your doctor will guide you what kind of test needs to be done and what medications to be taken. Do not neglect your fever symptoms at all. Then the BMC or the health authorities are quite active. We have fever clinics, we have blood tests which are done free of cost at also some places. So awareness is very important about monsoon disease. A word about prevention in terms of vaccinations. We have vaccines for flu, that is the influenza vaccine, we have typhoid vaccines, and we have vaccines for hepatitis also. So be aware of your surroundings, be aware of what the monsoon brings, take timely advice and medical help, and be healthy. Thank you.